I want to demonstrate a group of lower back exercises that are called Superman exercises that I find if my patients do, they do two things for them. One is they're less likely to suffer lower back injury, and the second is they will hold their adjustments that we perform here in the office for longer intervals of time. We're strengthening a group of muscles here called the erector spinae, and they run coming off of the lower bones of the spine called your lumbar vertebrae. Okay? We're going to demonstrate these in two different forms. I'm going to show you the first, or the most regularly used method. You'll be laying face down. You can lie down, obviously I'll be using this table, but you can use your mattress at home, or you can lay on the floor and use a pillow or a small towel placed under your abdomen for additional comfort. What you do is the first part of it is raise your opposite side arm and leg. So left arm, right leg, right arm, left leg. These are slow, deliberate movements where you slowly pause as you're making the motion. That is the first one. The second one is bringing the hands and feet together, and you bow the small of the back. Again, slow, deliberate motion where you pause and hold the movement. The final one is where you come onto your hands and your knees, and again raise opposite side arm and leg. Again, pausing as you make the motion so that you feel it's in that muscle group that we're targeting. I'm commonly asked, how many of these do you need to perform? You want to perform at least 10 to 15 reps of each. So when you're at the point where you're doing opposite side arm and leg, that counts as one for each side. Left arm, right arm, one. Then you move on and so forth until you get to that 10 to 15 scenario. I want to show you an advanced form of this as well. You can be doing this in your gym, or if you have an exercise ball at home. There are two parts to this. You'll be laying straight onto the ball, again straight onto your abdomen, resting either on your hands or your elbows, okay? The first part is whenever you're raising the legs straight up, keeping the feet together, okay? Again, slow, deliberate movements, and you pause. It's a little more challenging to rest on your hands. You need greater stability to do it, but the motion is the same with your feet, okay? The opposite one here is when you raise opposite side arm and opposite side leg, just as we did on the table a moment ago, where you're holding the motion straight up. Again, if you will perform these exercises regularly, routinely, you will see the benefits from them. They are very effective exercises that I hope you employ with your normal routine.